Good morning, everybody. Good morning. It's a very beautiful morning indeed from Lagos City in Nigeria. And we want to heartily welcome you to the first Faculty of Pharmacy Annual Scientific Conference with the theme Post-COVID-19, Charting a Course for the Pharmaceutical Sciences and Health Strengthening and Health System Strengthening. I want to welcome everyone who has joined us on this conference. I want to especially welcome the Vice Chancellor of the University of Lagos, Professor Oluwatoyin Ogundipe, who is ably represented by the Deputy Vice Chancellor, Academics and Research, Professor Oluwole Familoni. Prof, sir, you are very welcome. We welcome our own Dean, Professor Gloria Ajayi, the Dean of the Faculty of Pharmacy. You are welcome. We welcome all our speakers who have joined us on this call. We welcome all professors. We welcome all deans of different faculties in the University of Lagos, all heads of departments, all our distinguished conferees and participants from all over the world, from everywhere in the country, and of course outside the country. We want to welcome you all. We are so happy to have you with us on this conference, and I want to assure you that it's going to be a very enriching time. It's going to be a very fruitful one, and it's one that you would always remember. So once again, I welcome us all. So very quickly, we want to invite the Dean of the Faculty of Pharmacy, Professor Gloria Ajayi, for her welcome address. Dean, ma.
Thank you very much. The Vice Chancellor of University of Lagos, Professor Oluwatoyin Ogundipe, FAS, ably represented by the Deputy Vice Chancellor, Academic and Research, Professor Pharm, the Registrar, Mr. Oladejo Aziz, Esquire, the Bossa, Mr. Lawal, the University Librarian, Dr. Zaid, other members of the management of University of Lagos, deans of faculties, heads of department, professors, academic and non-teaching staff, and students of University of Lagos, the president of Pharmaceutical Society of Nigeria, pharmacist Mazi Sam Ohabua, the chairman of PSN Lagos State, pharmacist Iyiola, the national chairman of National Association of Pharmacists in Academia, Professor Ibezin, fellows of Pharmaceutical Society of Nigeria, our distinguished speakers and participants in this conference, ladies and gentlemen, it is with great pleasure and honor that I welcome you to the first scientific conference of the Faculty of Pharmacy, University of Lagos. This is the first scientific conference to be organized in more than 40 years of the establishment of the faculty. The challenge to organize her scientific conference was thrown by the Deputy Vice Chancellor, Academic and Research, Professor Oluwole Familoni, during the University Management Advisory Visit in preparation for the 2019 National Universities Commission and Pharmacists Council of Nigeria accreditation exercises. The challenge was well received by the management and staff of the faculty. Soon after the accreditation exercises, it was resolved at the faculty management meeting held in December 2019 that we will organize the first scientific conference in the year 2020. However, with the incursion of COVID-19 pandemic and subsequent lockdown to contain its spread that followed affected both the planning and consequently modification of the title and objectives of the conference to address the current challenges brought about by the pandemic. It is obvious that this pandemic has brought about tremendous challenges to the pharmaceutical sector. Hence, the title of the conference, Post-COVID-19, Charting a Course for the Pharmaceutical Sciences and Strengthening the Health System. It is not only the title that had to be modified, the mode of the conference was also modified. A virtual conference was adopted to ensure maximum participation for all those who have shown interest in the conference while complying with COVID-19 restriction protocol of social distancing. The date was fixed for October 21st and 22nd, 2020. Apart from the COVID-19, there was also the strike by ASU for the revitalization of Nigerian universities. We are told by the end of October the strike will have been over, but this was not to be. Finally, the NSAS protest in Lagos. It was at the height of the preparation of the conference, in fact, a day, 20th October 2020, to the commencement of the conference, that the unfortunate Black Tuesday event in Lekki Tollgate happened. All these events culminated to the postponement of the conference. After the strike was over, the planning conference chose a new date, which was March 10th and 11th. We had other challenges with our guest speakers who had scheduled engagement for the day. So we had to start looking for new speakers, And here we are today, holding the first scientific conference of the Faculty of Pharmacy. No doubt that the COVID-19 pandemic has tremendous impact in pharmaceutical sector and consequently effect on healthcare system. It is important that as pharmacists, that we stand up to these challenges and evolve practices and policies that will provide solutions that will address the challenges and strengthening the health system and ultimately benefit the patient. The area of focus include the following: digitalization of all areas of pharmacy practice, information and communication technology, artificial intelligence and robotics, local production of active pharmaceutical ingredients, and manufacture of drugs, advancing pharmaceutical care in community and hospital practices, small-scale compounding and production of drugs in the hospitals, and virtual blended mode of teaching and learning in universities. Some of these areas will be addressed during this conference. Apart from addressing the impact of COVID-19 during this conference, hosting an annual scientific conference by the faculty will provide a forum for sharing research findings by faculty members with all other scientists and pharmacists. This will encourage collaboration, especially with the other pharmaceutical sector and scientists, both nationally and internationally. This will be for the benefit of the patients and ultimately strengthen the health system. At this conference, we have both nationally and international speakers. We have Professor Noel Wanang, the Secretary General of West African Pharmaceutical Federation, Professor Adeboye Adejare from the University of the Sciences, Philadelphia, United States of America, Professor Kunle Olobayo of NIPRD Abuja, Dr. Muyosore Adejumo, the immediate past Director of Pharmaceutical Services, Lagos State, Pharmacist Ignatius Anuku, the CEO of Alpha Pharmacy and Chairman Naib, and our own alumnus, Pharmacist Additional Panubi, the lead consultant from Alliance. All these speakers have wealth of experience in all areas of pharmaceutical sector, and they will be sharing of their experiences that will help us evolve ways of charting a new course in pharmaceutical sector that will assist pharmacists evolve solutions and innovate ways in addressing the current challenges brought about by COVID-19 and ultimately strengthening the health system in Nigeria. I wish to commend and congratulate the chairperson, Professor Aderonke Adepojubelo, and members of the conference planning committee for their commitment, resilience, and tenacity that the conference must hold in spite of all the daunting challenges. I give God all the glory for making this conference a reality. On behalf of the management, staff, and students of the Faculty of Pharmacy, I hereby welcome you to the first scientific conference of the Faculty of Pharmacy, University of Lagos. I wish everyone, speakers and participants, fruitful deliberations and a successful conference. May God bless you all. Thank you for listening.
Thank you very much, the Dean, our own amiable Dean of the Faculty of Pharmacy, Professor Gloria Ajayi, for that wonderful welcome address. We don't need to say anything again. You are all warmly welcome. For all who have just joined us, we are still saying welcome. It is still the first virtual conference, first scientific conference of the Faculty of Pharmacy of the University of Lagos. For those of you who don't know, the University of Lagos is the university of first choice and the nation's pride. We welcome you all to day one of this conference, and we know it's going to be a very fruitful one. Very quickly, we want to welcome our chief host, who is no other person but the Vice Chancellor of the University of Lagos, Professor Oluwatoyin Ogundipe, who is ably represented by the Deputy Vice Chancellor, Academics and Research, Professor Oluwole Familoni. DVC, sir, you're welcome.
Good morning, ladies and gentlemen. The Dean of Faculty of Pharmaceutical Sciences, for Faculty of Pharmacy, the special guests, those physically somewhere else, they are somewhere else, local organizing committee, members of the faculty, different professors from different areas of science that have joined me. Good morning. It's my pleasure to represent the Vice Chancellor of the University of Lagos, Professor Oluwatoyin Ogundipe, who is unavoidably absent due to other matters in Abuja representing the university, but has asked me to represent him. But even if I'm not representing him, I'm a friend of the faculty as a chemist, so it's my pleasure to be here. I wish to welcome you to the University of Lagos. For those who are coming from here, near and far, University of Lagos, University of First Choice and the nation's pride. That has made it possible for us to be able to have this meeting. The meeting, this conference, the first of its kind, was supposed to have taken place last year, but due to pandemic, it was unable to, and also due to the strike, which made it impossible. We tried as much as possible, but it was not possible. But it has given rise to a new situation where it's now a post-COVID now, that is now the new topic. So it means all things work together for good for us. We want to congratulate Faculty of Pharmacy for having this first annual conference virtually. It is due to the new normal that has made it possible for us to hold this. But it has also made it possible for us to get those people from America or anywhere in Nigeria to be able to be guest speakers for us, which would have been difficult staying so much in the airport, no visa, no connecting flight, but we are having it now without trouble. So we thank God for that. So this topic of this conference is very apt because pharmacy is a central portion in the treatment of COVID. Even though the doctors give care, but they have to give drugs to people to solve this problem. So pharmacy is in the center of this treatment, and this conference is very apt to see the treatment of COVID and see how it will affect the treatment and care for pharmacy for patients in this situation. This conference will give us opportunity to share experiences from different areas, from the diaspora, from every part of Nigeria, and from all areas. It will give us opportunity to have a local treatment, local perspective, and different experiences that will be collated, that will be very useful in the treatment of COVID-19. And we have seen that the work of the pharmacists has made it possible for us to have ability that we have to be able to still be alive. Because if there have been no drugs and people don't know what to prescribe, it would have been impossible for us to continue our lives as we are gradually coming back to have this conference. I'd like to congratulate the Dean of Pharmacy for during your tenure this is happening. I know the lot of work that you have done to make it possible. And to your LOC, they've done a wonderful work to make it possible. I know how many times they have come to see that it will really happen. So thank those who are participating. I hope from your presentations, you will advance your knowledge and your interest in solving this problem will be increased. And at the end of it, everybody will be Nigeria and everybody will be happy about it. So I want to welcome you to the University of Lagos, even though you are not here, but welcome you to the conference taking place at the University of Lagos. I hope that this will not be one conference alone. It will be a continued annual conference during which topical issues will be discussed, and the faculty generally will improve and body of knowledge will increase. So I welcome you to the University of Lagos on behalf of the Vice Chancellor, and I wish you a very good conference. Thank you very much.
Okay. Thank you so much. The Deputy Vice Chancellor who has represented the Vice Chancellor, thank you for this opening charge. The Vice Chancellor has told us that the topic for this scientific conference is very apt. So you are not wasting your time at all. You are in for a very good time and a very fruitful scientific time. So very quickly, we want to welcome the chairperson of the planning committee for this conference to give us an opening remark. We want to welcome Professor Aderonke Adepoju-Bello for her opening remark. Prof. Ma.
Good morning, everyone. Please permit me to stand on the well-established protocol. Thank you. You are all welcome to this very first annual scientific conference of the Faculty of Pharmacy, University of Lagos. Dear professors, colleagues, students, ladies and gentlemen, you are welcome. It is my pleasure with great joy to welcome you to the first annual scientific conference of the Faculty of Pharmacy, University of Lagos, the University of First Choice and the nation's pride. As we were planning for this conference, last year, 2020, COVID-19 pandemic emerged and ASU strike also set in, leading to the postponement of the conference. We had to postpone the conference due to ASU strike, but we thank God for the conference is holding virtually today. The theme for this conference is post-COVID-19, charting a course for the pharmaceutical sciences and health system strengthening. This theme and the sub-themes are of utmost importance to the pharmaceutical industry, hospital, community practice, and the academia at this period. In fact, to the whole community in Nigeria. Our speakers are uniquely placed to address the theme and sub-themes of this conference, which centered on every area in pharmacy. They are from the pharmaceutical industry, hospital, community practice, and academia to address the new normal in carrying out our duties at this pandemic period for the benefit of humanity. Ladies and gentlemen, we have participants for oral and poster presentations of their research works in a pre-recorded video format. This conference promises to be very enlightening and educative. Whether you are in this line of pharmacy or not, doesn't matter. You are going to enjoy the conference. I have so many mates right from secondary school, primary school, asking me, can we join? And I asked them, you are free to join. I'm very grateful to all our speakers, abstracts, reviewers. They did a lot of work. Assessors of presentations at the parallel sessions, presenters, and all participants. A big thank you to our VC, our Vice Chancellor, all management members of the University of Lagos, our Dean, Professor Glory Ajayi, all professors here present, colleagues, and non-teaching staff in Faculty of Pharmacy for their encouragement and support. I wish to thank my colleagues, the Conference Planning Committee. Oh, great, you did a lot of work. And all the subcommittee members and those that were co-opted, thank you very much for your total dedication, hard work, great support, encouragement, and burning of data at our meetings, long meetings. Thank you very much. Thank you all for attending this first annual scientific conference of the Faculty of Pharmacy, University of Lagos. And we look forward to your participation fully. On behalf of CPC, the Central Planning Committee, and the whole Faculty of Pharmacy, I wish you a successful conference. You are welcome. Thank you.
Thank you very much, Professor Adepoju Bello, for that welcome remarks. You've heard it all. This conference boasts of speakers that span across all the different fields of pharmacy practice, and it promises to be a very, very enlightening one. What else can you ask for? So we are moving. We want to call on the keynote speaker. We want to invite our keynote speaker right about now for his keynote speech. But before then, we are going to quickly read a citation of our keynote speaker. So our keynote speaker for this conference is Professor Olobayo O. Kunle. Professor Olobayo Kunle is a pharmacist with over 35 years post-qualification experience, all of which he has spent as an academic pharmacist. He began his career as a lecturer in the Ahmadu Bello University, Zaria, before moving to the National Institute for Pharmaceutical Research and Development, Abuja, as a research fellow. As a researcher, he has been actively involved in the development of pharmaceutical raw materials from local sources, the formulation of herbal medicines, and drug quality assessments. He coordinated the studies on niprosan, ensuring the smooth scale-up of its production to commercial scale. He has published over 70 scientific papers in peer-reviewed journals and presented a number of papers at both local and international conferences. He has been a member of a number of committees, including the Presidential Committee on the Pharmaceutical Sector, Ministerial Committee on Health Sector Reforms, Committee for the Development of the Pharmacovigilance Policy, and the Ministerial Committee for the Development of the Guidelines for Drug Distribution. He was on the Committee of Experts that produced the first edition of the Nigerian Herbal Pharmacopoeia. He was also a member of the Committee of Experts appointed by the West African Health Community to produce the maiden edition of the West African Herbal Pharmacopoeia. He is presently the alternate lead of the Research Functional Group of the Presidential Task Force on COVID-19, Chairman NIPRD Research and Development Committee, and leads its COVID task team. He is also a member and rapporteur of the WHO Regional Advisory Committee on Traditional Medicine for COVID-19. He was Acting Director General of the National Institute for Pharmaceutical Research and Development, Abuja, and is a fellow of the Pharmaceutical Society of Nigeria. Ladies and gentlemen, distinguished conference participants, I welcome you all, and I want to heartily ask you to welcome with me Professor Olobayo Kunle, our keynote speaker.
Thank you very much, MC. I appreciate the introduction. And I particularly thank you for getting the pronunciation of Olobayo correctly. Not too many people are able to do that. The Vice Chancellor, represented here by the Deputy Vice Chancellor, Academics and Research, Professor Pharm, the Dean, Faculty of Pharmacy, University of Lagos, Professor Gloria Ajayi, and the Chairman of the Central Planning Committee, Professor Adepoju Bello, who has become a pen pal. In the past 6-7 months, I've received more messages from her than I've received from anybody else. Thank you very much for having me at this very historic conference. I'm particularly honored to be asked to be the keynote speaker at what is the first of these conferences in a university of the status of University of Lagos. I'm humbled and thank you very much for the opportunity. The COVID-19 has been an experience. Do you want me to share my screen from here, my presentation, or you are sharing from your end?
Yes, you can, sir. Okay. You can share your screen, sir.
Okay, then. Okay. Okay. So the COVID-19 has been an eye-opener for the whole world. And I believe that the organizers of this conference have taken to heart these very important statements that some of you might have come across. Raheem Emanuel is an American politician, and he says, historically, don't waste a crisis. The very popular Winston Churchill had said this before him. He put it this way: never let a good crisis go to waste. So I believe that the organizers of this conference have taken this principle to heart and have decided that what the tough times that the world has gone through should not be wasted. We should quickly pick the lessons and make use of them. One of the advantages, for example, in this crisis is the fact that you're able to hold this conference, I'm sure, at minimal financial cost. For example, I am traveling. For those who look closely at my background, I'm in a hotel room. Ordinarily, I wouldn't be able to make this presentation. I would have told the organizers I'm not available. But because we've had this crisis, we've discovered new ways of doing things. And so I'm glad to have the opportunity to speak on this subject at this very critical moment, because I do know that this is a turning point in our lives, especially as research scientists, as pharmacists, as chemists, whoever we are. We have come to look at who we are from a different perspective. And we have come to see again that those things we do in our labs that people think, what the hell are you doing all these years, have suddenly become very, very important. And we have seen that the distance between the lab and the clinic, the distance between the laboratory and human life has become so short. I mean, some of the vaccines and medicines that are being used today did not exist 6 months ago. They did not exist at all. So hopefully as a people, we will also learn the lesson that what we do in research is something that is relevant to people, and that we have to find a way of making our work relevant and immediately valuable. In this presentation, I hope within 25-30 minutes to quickly highlight the challenges posed by the COVID-19 system to our health system and the connection between the pharmaceutical sciences and the health system. Let me say up front, basically, I'm a pharmaceutical researcher, and I don't claim to have too much knowledge in the health systems, the bigger system. I know the role of pharmaceutical sciences in it, but fortunately you have speakers like Professor Wanang who will dwell more on the health system. But again, I'm also one of those fortunate pharmaceutical scientists, one of those fortunate academics who have had exposure to different sectors. At the time I was production manager. I've also had the opportunity to manage research and also get involved in some hospital activities with our colleagues. I'll also be highlighting the state of our sector, the state of things before the onset of the pandemic, the challenges posed to pharmaceutical R&D by the COVID-19 pandemic, and most importantly, for the subject of this conference, I will identify the tools required, in my opinion, for charting the course for the pharmaceutical sciences and health strengthening post-COVID. And I hope with the number of activities happening now, post-COVID will soon come. So we should be ready. And I will also then propose some action points. So by way of a background, the health system, I asked myself, why did they put health system and pharmaceutical sector together in the title of this conference? And of course, it is because the health system depends on a sound pharmaceutical sector, while the sector itself, the pharmaceutical sector, depends on a very vibrant pharmaceutical sciences subsector. Now, I highlight this because in this country, the pharmaceutical sciences subsector is 100% dependent on academia. And when we say academia, we are talking of, in this country, essentially, we are talking of places like University of Lagos, public universities, and research institutes. We are not yet there where pharmaceutical sciences, pharmaceutical research, drug development will take place in the private sector. That is practically non-existent. And like in every situation, public health emergencies expose the weaknesses of health systems, even the most robust health systems. We have seen how the places we used to think were run by magicians have practically been brought to their knees by the COVID-19 pandemic. We saw the American health system, it is still struggling. It's still struggling very much. We've seen Europe, right now most of Europe is still confused. So these were places we thought things happen by, they just happen. We have seen the soft underbelly of such systems. Now, if such systems were shaken, then what of us? It is obvious that it's been a tough ride. I guess I will make more details later. But the point is that the COVID pandemic has shown the weaknesses of all systems and especially ours. And I like to use the phrase, I had used this in an article I wrote some time ago, a reality check. That is what COVID-19 has been for everyone in different sectors. Now, what's the state of our pharmaceutical sector pre-COVID? Because to chart a way forward, you have to know where you are, you have to know where you were, and then of course, where you want to be. Our pharmaceutical sector, 200 manufacturers, a few of them with WHO pre-qualified facilities. They have highly skilled manpower, but unfortunately, it's a very small pool when we look at it realistically. Our pharmaceutical sector is reputed for very high quality products. It practically owns the West African sub-region. There is no competition for it there. And what of our pharmaceutical sciences? Pre-COVID, I'm narrowing, it's not exactly correct to assume that all of the pharmaceutical science activities happen in the faculties of pharmacy. I do acknowledge that a number of our colleagues and specialists in different areas make up the system. But to put our finger on something we can measure, we have 21 schools of pharmacy. We have a very rigorous training curriculum. For those of us who have been involved in training foreign graduates, you are almost embarrassed that they are holding the degree of B Pharm or Pharm D, whatever it is they have come in with. When you compare them, their knowledge base to that of our students here. We have very well established postgraduate programs. We have many senior academics. When I was graduating in the 80s, my faculty of pharmacy in Zaria had only one professor. Today, when I look at the number of professors we have in our various schools of pharmacy, we cannot deny the fact that we are definitely not short of senior academics, experienced lecturers, and then our graduates, our pharmacy graduates are smart, they are ambitious, and they are very knowledgeable, very, very knowledgeable, especially in things that many of us in the old school do not even begin to think are important. So what are the lessons that we have learned from COVID-19? Remember, all I'm trying to do is contextualize the whole process of charting a way forward because we need to know where we are. What are the lessons? For the health system, It has shown that our health system is very weak at all levels. And this is as a result of both manpower and resource challenges. The infrastructure is just not there. It might sound like a very long time ago, but you know, about 6-9 months ago, when you were all very worried about the number of ventilators in this country, it was so frightening. I mean, I'm asthmatic, and I was sitting in my house sometimes, and I'm saying, so if I do catch COVID now, everybody's just going to watch me choke to death, because I knew that in Abuja, as big as it was, there were less than 10 ventilators that were functional, and which meant I probably wouldn't have had access to it at all. Those were the realities that we found with our health system. We also have found that it is the weakest at the critical link, that is the primary health care. Even now, I don't know how many ventilators, oxygen plants have been put in place, but whatever it is that has been put in place, what does it matter to a system that has to address 200 million people? I mean, I was looking at something recently, and the per capita expenditure on the health system for Nigerians is $6 per citizen. Compare that to Norway, where you had $6,177, and the United Kingdom, where you had $3,235 per citizen. For the Nigerian, it is $6. So these were the realities that the pandemic brought up and reminded us that we are really on very fragile ground when it comes to our health systems. It also showed that our health system was fragmented. Do you remember the lockdowns, when an announcement will be made by the federal government that there will be a lockdown, and another state governor will tell you that his state is immune from COVID-19, and so there will be no lockdown? Now that is a political problem, because our federation has segmented the health system: primary health care for the local government, secondary and some form of tertiary for the state government, and the federal government tertiary, and then it has gone into secondary. But the point here is that we have a system where there is no centralized control of the health system, unlike, say, Ghana, where the minister or whoever is in charge of health makes a statement, and that is what happens across country. So that has led to discordance. And then the reality is public sector awareness was very, very poor, which had to do, of course, with trust in government. The messaging was not working, because as soon as a minister of information or a minister of whatever is speaking, the average Nigerian says, oh, not lied, and they talk. So that took time. And at a time, you remember when it started, because it started with those who were traveling abroad a lot, the average Nigerian said, oh, COVID-19 is the case of the rich also cry. It's their problem. It's not our problem. So we had a system that was also unprepared to take the output of research. Remember, and that's why I said one of the advantages of this crisis is to shorten the distance between the laboratory, between the research carried out by our clinical pharmacists and others, and the bedside. The drugs we are using today, the drugs we are all hyping, the vaccines and all of that, straight out of the lab to people, which is why some people are even reluctant to use them. But that is just the reality. But we have a system that is unable to absorb the output of research. When I see us arguing strongly for ivermectin, strongly for chloroquine, I said, if a Nigerian had been the one who first came up with this concept, we won't touch it. I'll give you a personal experience. About, I think it was in June or July last year, we were developing, I was leading a team developing a protocol for clinical trials for COVID-19. And we were working with some of our clinician friends, because of course the trial was going to take place in a hospital. And one of the ideas my team came up with was to try out ivermectin as part of a regimen. We had read the Australian paper on the in vitro activity. We were familiar with ivermectin in Nigeria. And we said, okay, let's try it out. Our clinician friends totally refused, because it had not been used by anybody. They couldn't find papers to support it. So they were not going to try it out. In fact, they started telling us of the toxicity and dangerous effects of ivermectin. I had to go back and ask myself, are there two types of ivermectin, different from the one we've been using? But the point I'm making here is, if these things had come out of our labs here, our health system is not prepared to absorb the output of research. Now, what's the state of our pharmaceutical sector? What has the COVID-19 shown us? That we are totally dependent on imported pharmaceuticals. 80% of the drugs we use in this country are imported either from India or China. And we spent in 2018 over $600 million on that. Again, it has reminded us of how much we've refused to invest in what is important. One of the statements I love, someone made it during the pandemic on one of these international news outlets. He said, you do not build a fire station when the fire has started. Nigeria did not have a fire station in terms of a pharmaceutical sector, drug security, when this fire came. So whatever it is we were saying, as I joke, it was free to air. We were simply talking because we had no capacity to deliver on anything. Look at the size of the pharmaceutical industry in economic terms, 0.25% of GDP. To give you context, Nollywood, entertainment, enjoyment, laughter is 1.42% of the economy. Remember, this is not an allocation. This is what that sector has generated by itself into the economy. So if you are sitting in Abuja as an economic planner or in charge of the country's economy, you will forget the fact that you are a research scientist and you understand the importance of your work to lives. You will tend to give more attention to Nollywood because it will bring in more money for the country. Those are challenges we need to look at. We have absolutely no API production, active pharmaceutical ingredient, zero. We all started running helter-skelter when our friends from India said they were no longer going to allow some things to be exported. We started hoarding. I, for example, started hoarding chlorpheniramine because I felt I was going to have to use chloroquine. And I remember that in the days when chloroquine was used for malaria, I used to itch. So I was imagining what was I going to do. So I'm sure each one of us kept a little more paracetamol or something at home. That is because we have no API production. We make a limited range of products. And unfortunately, the products we make are low-value products, not the real critical things we need. Once in a while, I introduce these things just to remind us in graphical terms where we are. That's Nigeria, improvement in manufacturing sector. And you will see that Nigeria is the only country in Africa whose manufacturing sector has shrunk in size between 1981 and 2018. Again, low installed capacity in our pharmaceutical sector, infrastructural challenges. It is highly vulnerable because it depends on imported raw materials. And there is a disconnect between R&D and industry. I want us to remember that. There is a disconnect between our R&D sector, that is those of us in the universities, those of us in the research institutes, and the industry. And so there's low research uptake. And there is a relatively unattractive environment for the industry to engage in R&D. I mean, there is a lot they can say for themselves about why they are unable to do the things that we think they should do. You go to them, you expect them to sponsor your research. You don't want to look at their financials. They are also facing serious challenges. But the fact is, we have a sector that is not engaging in R&D. Yeah, that was in the days of the lockdown when you had to find things to do, I became a newspaper columnist temporarily. And I titled that as the moment of truth for Nigeria's research and development sector. That is what COVID-19 became. That is what it has become. And that is why we're having this conference. And that's why I commend the foresight of those who have put this together. Now, what were our discoveries in the pharmaceutical sciences as far as COVID-19? What did it show? It showed us that there's massive societal expectation. All the conversations, if you remember, about this time last year, you scientists, what are you even doing? You say you've been a researcher for 30 years. What have you done? Suddenly we became the issue. I mean, I told someone that the media attention that NIPRD, for example, got in the space of 2-3 months was more than all the media attention it had in 30-35 years. I mean, that was the first time I was seeing a research project sent to the institute, personally signed by the president himself, asking us to do a particular thing. We became very important. But that also came with the fact, it also showed up the fact that we were not practically ready to assist society. it also showed us that the society, you and I, the society trusts and in fact hopes that we will be able to solve its problems. That responsibility we must always remember going forward. It also showed that we had enthusiastic academics. Our friends started trying things out. Oh, we are now making hand sanitizers. Oh, we are assembling ventilators. We are doing this. Well, neither here nor there. For me, these were not the things for academics to do. If you go on the website, if you go to the WHO website, you find a formula for hand sanitizers. But it just showed that people wanted to do something. It also showed that we have skilled academics. Popularity of herbal medicines. Many people did not appreciate what herbal medicines were about, but you see, when we had a back against the wall, the next thing was herbal medicines. What can we find? And it also shows the primacy of herbal medicines development. Most importantly, it has shown us the value of non-drug R&D. So as pharmaceutical scientists, we need to remember that our work does not begin and end on the laboratory bench, but rather we have to look at the totality of our work. Remember, for example, when the world was at a loss, no drug, no vaccine, it was non-pharmaceutical interventions that came to the rescue. So we also have to find a way of making ourselves relevant in that area. So what were the challenges? The high burden of expectation. I tell you, it got to a point where it almost became uncomfortable to introduce yourself as a pharmaceutical researcher, because the conversation, whether it's family or friends, was going to turn around and find a way of blaming you for not solving the problem. We were unprepared. That is the truth. We have all learned to get used to the fact that society was not expecting anything of us. And so we just settle in and we do not bother at all about whether what we are doing was relevant to society or not. Now, talking to us as us in-house, it also showed that we had drug development rustiness. We were really not prepared to go fast, quickly into drug development. Many reasons for it, but that's the truth. We were rusty. Poorly resourced. Our activities have not been product focused. And as a group, even within, say, our association, in NAPA, we had no shared research agenda. Everyone was lashing out. Everyone was trying to do something. But then in a crisis, if firefighters in a fire are all trying to do something without coordination, that fire will not be put out, or some firemen may get injured. So the absence of a research agenda was brought out by this pandemic. Well, just to remind you again that part of the unpreparedness was the fact that as a country, we allocate only 0.02% of our revenue to research and development. Then I mentioned the lack of coordination, even within research teams, even within that faculty of yours, the Faculty of Pharmacy, University of Lagos. I can bet that there are pockets of knowledge that have not been brought together. There's a long lag time. There are gaps in our pharmaceutical R&D landscape. And there is a gap, I think I've mentioned that, between the R&D and the industry. Then there's something I call tunnel vision in research. We have almost all of us, I think apart from our friends in clinical pharmacy, every researcher in the pharmaceutical sciences today is focused on herbal medicines. And unfortunately, focused on herbal medicines for symptomatic treatment. No synthetics, no vaccine, and very narrow scope. I think somewhere down the line in charting the course, I will say a little more about this tunnel vision. Again, this the TED Fund chief executive agrees with my concept that our universities, unfortunately for me, I call them now, they have become centers of teaching rather than centers of training and learning. There's too much teaching going on in our universities. And by teaching, I mean basic undergraduate teaching, which is distracting our very intelligent professors and others from doing the things that made them professors. Because actually you become a professor for doing a lot of research, but then suddenly you spend all that time teaching undergraduate courses. Again, this is a quote I like because it says there how much resources we are putting into research. For example, it says there that in 2011, there was 97 billion allocated to all the research institutes in the country, out of which 42 billion was for personnel. And so of the 44 billion allocated to capital, only 10 billion was for research activities. So only 10% of even the little that goes into the research sector ends up being used for research. Okay, so that's where we are. But as Nigerians, as scientists, what is it that we want? We want a robust and responsive health system. We want it to be well coordinated and resourced. We want a pharmaceutical sector that can provide drugs and other supplies to respond in an emergency. We want a fire station before the fire comes. We want to meet 60% of the country's need through local production. I have put real local production in capital there because local production, it has to go beyond what I call assembly. We want an R&D system that will maintain the product pipeline for pharmaceutical manufacturing sector. At any point in time, there should be many options for the system to try out. We want pharmaceutical scientists who can provide robust support to the industry. We want knowledgeable researchers who are enabled and resourced to work continuously, not now that the CBN is ready to give some grants because there's COVID-19. Will they be giving grants in 2022? Will they be giving grants in 2025? We need to work continuously. Then we want a system that will provide in-country solutions to our health problems. And then we also want to beneficially exploit our country's flora as a massive resource base for the pharmaceutical sector. Here, I mean herbal medicines. Because you will notice that even though we spend so much time talking and working on herbal medicine, how many of our pharmaceutical manufacturers in the country today are configured to make herbal medicines work? Very, very few of them. So we have to find a way of synchronizing this energy and resources we spend in research on herbal medicines with what actually happens in the real world. So charting the pathway, charting the way forward. I found these interesting pictures just to show paths. And to do that, we need building blocks. You'll notice one of my pictures, the one on the right, has a paving, some type of interlocking concept. So you need building blocks to chart the way forward. Now, to do that, we can spend the whole day talking about what our government, what our system has failed to do. For me, there are two sets of things we can do. What we, you and I, can try to do, the university, the faculty, we researchers, and then their own. I just highlighted this to point out that somebody had mentioned that for us, for any system to move, it needs a combination of knowledgeable, skilled, and competent people to lead industrialization. And that the technological system of a nation has two types of framework, the invisible one and the physical one. The invisible is made up of knowledge, skills, and capabilities. You and I can handle that, knowledge, skills, and capabilities. So what can we do? How can we use our power, our intellect, our resources in that respect to help develop, to create that pathway? So for me, looking at the pharmaceutical sciences specifically, which I had, like I have said, is resident in the universities and the research institutes. The first thing that I will propose is a mindset reset. Mindset reset. Many years ago, I was in India for some attachment to a manufacturing industry. And some young chemical engineer graduates were asked to take me around. And I noticed that none of them planned to be in that company for more than 5 years. They wanted to go and set up and do something for themselves, to produce something. So we need to create that new mindset. Can do, must do, will do. That is very important. I know I'm beginning to run out of time, so I'm going to go a little faster. Then we need to have a national agenda. Central setting, we must decide as a group, what do we want to do in terms of drug development? Do we want to innovate? Do we want to improve? Do we want to copy? For example, right now, we tell us we should go for copying. There are drugs that have gone off patent rather, that we can copy for free. But in doing this, let us have a coordinated approach. Today, we all want to do something about COVID-19. What are we doing about malaria? What are we doing about hypertension? So let us have a central agenda. Then there should be a sectoral agenda. Your faculty, NAPA, do we have a skills map? Do we know where an expert in A is and where an expert in E is, so that when we need A and E together, we can link them? What disease areas do we want to focus on? Herbal medicine research has to be systematic. The present way we are going about herbal medicine will not take us forward. As researchers, when Professor A says, I have a drug on the market, is it different from what herbalist B has? This total crude, I don't think is the way to go. As scientists, we have to go beyond total crude. We have to add value to herbal medicine research so that herbal medicines will truly go on the country's essential drug list, because these crude extracts are too weak to be used in serious cases and in cases of emergency. We must decide what we want to do systematically in research into phytomedicines. And also, we should look at phytomedicines for providing leads for drug development. And then we define our manpower development goals. As university lecturers, as professors, you also have to look at the training. What is in our course content, especially the postgraduate training? It needs to be more practical. We have to make people do things that give them skills after they have finished the postgraduate studies. The course delivery should be focused on problem solving. The training requires a philosophy. We need to check again. Why are we training people? For what purpose? What do we want them to achieve for our country? And there must be R&D exposure. I remember as a first-year student, my class synthesized acetylsalicylic acid. Today, you meet people who are doing master's degree programs in chemistry, and they've not done any synthesis. The truth is, we must agree again that we seem to have disconnected from our source. We have many of, forgive me, most of our professors of pharmaceutical chemistry today are into drug analysis or herbal medicines. There are very few who are doing synthesis. There are very few who can actually train people in the production of active pharmaceutical ingredients. We need to ask ourselves what we want to do there. Then we need to create synergy, multidisciplinary. I cannot sit in my lab alone and develop a drug. It's not going to happen. There's no one of us that has that kind of skill. We must connect with others. Multi-sectoral, leave the faculty, go to the Department of Biology, go to the Department of Philosophy, go to Sociology, work with them so that we can move faster. And then let each one of us focus on our areas of strength. And then coordination is required. We must do research for product development. Unfortunately, research for promotion is a world away from research for product development. That is why I'm excited that we now have a large pool of senior scientists who do not need to worry too much about how many papers they publish. They are already professors with experience. They should be driving product development. This, for me, is a mandate to our senior academics. We must aim for patents and practical application. Let us start with existing molecules. Let's teach our master's students how to copy the synthesis of a Viagra, for example. We must go beyond preliminary studies in herbal medicine. We must begin to do deep research in herbal medicines. Unfortunately, we have to know that our advantage in herbal medicines is not going to last forever. The trees are being cut down. If we do not work fast, we will lose our advantage. Yes, plant medicine development, there must be documentation. Let us stop repeating ourselves. Let's stop doing the same work over and over again. Then there must be systematic verification of our claims in herbal medicines. It must go to the clinic. We cannot continue to say they don't want to use our herbal medicine. They will not use it if we do not provide solid clinical evidence. Let's push the envelope. I find it funny that some of the herbal medicine research we are doing is the same thing people like us did 25 years ago. We must move forward. Let's push the envelope. We must come up with pharmacokinetics. How do these herbal medicines, what do they do to the system? And then sustainable utilization. When you say that this plant is good, Can you continue to produce it? Like my citation mentioned, I was involved with NIPRD. Then it is when the industrialist came, how is he going to get his raw materials on a continuous basis? As a country, as a system, as a sector, we must give a thought to APIs. When you are truly sick, what is used for you is a drug made from API. So let us target high impact diseases. Let's rebuild capacity. Let us not deceive ourselves. We have lost a lot of capacity in API development, even at the research level. The refinery, I'm told Dangote's refinery is going to have a petrochemical section. You are in Lagos. Please link up with that refinery and see what new opportunities that provides us so that we can scale up lab processes. And at least my generation of scientists should have produced a set of young scientists who will do practical API production for this country. It is embarrassing that 200 million of us cannot produce any API at all. We must change that. And finally, we must communicate. We must talk to the industry. Sitting in the faculty, in our research institutes and thinking we can solve problems for the industry is a failed approach. It just will not work. So I thought this probably is my last slide. I can see the MC. Let me just say, because this is a faculty organized program, I thought I should mention a few action points that I think you as a faculty can immediately take. Create a faculty R&D agenda, engage in some politically correct research. It doesn't need to be fresh. It doesn't need to be that it will result in publication, but it will give you publicity. It's useful for advocacy. You must find such. Then you should champion the development of a sectoral R&D. Let University of Lagos be the one driving NAPA to say, look, let's come together and determine where we want to go. Establish cross-specialty, cross-institutional, cross-generational teams. Our young people are very, very innovative. They are thinking far ahead of where you and I are. Let us draw them into our systems to take advantage of them and develop local models for herbal medicines research. More of the same will not work. We should stop doing what we are doing with herbal medicines. Let's move forward. We must recreate and encourage API drug research deliberately. And then we must find a balance. We have totally abandoned every other thing for herbal medicines. We must find a balance between herbal and synthetic medicines development, train and teach with drug development in focus, engage in real communication with industry. Faculty of Pharmacy Lagos, you particularly have an advantage. The industry is there with you. Speak the language of the industry and position to take advantage of the new refinery. I'm be ending with something like this. My daughter is an engineer. I don't understand too much maths, but it says that doing nothing, you saw that it will give you 1. But adding 0.01 to it, small consistent effort will give you dramatically different results. So I say that a crisis creates, I'm quoting now, a crisis creates a sense of urgency such that actions once believed to be options become essential. And while a pessimist sees the difficulty in every opportunity, an optimist sees the opportunity in every difficulty. May that be our approach to this. And once again, I thank the organizers for giving me this chance. And do remember, a crisis is such a precious thing that we should not waste. Thank you very much for listening.
Wow. Thank you so very much, Professor Olobayo Kunle. Please, wherever you are, I want you to give a resounding applause, round of applause for Professor Olobayo Kunle. That was a fantastic presentation. I mean, I don't know how best you would have had it. That was a brilliant, well thought out, thought-provoking, and excellently delivered keynote speech. Thank you so much, Prof, for your time and for this. Indeed, you have left us with a lot to ponder on. So Prof has, very conveniently and successfully taken us through the challenges posed by COVID-19 to the health system. He started with that. He then took us through the nexus between the pharmaceutical sciences and the health system, took us through the state of things before and the onset of COVID-19, x-rayed the challenges of pharmaceutical R&D exposed by COVID-19. He then identified the tools required for charting the course for the pharmaceutical sciences and health system strengthening post-COVID-19. And he concluded with proposing action points, such as resetting our mindsets, a mindset reset. I find that very, very intriguing. Having a national agenda, sectoral agenda, training, synergy. Oh my God, that was a lot. Thank you so much, Prof. We appreciate you. We appreciate your time. We appreciate all that you have shared for us. Thank you. God bless you. So we are moving. Those who are just joining us, we welcome you. It is still the first scientific conference of the Faculty of Pharmacy of the University of Lagos. We have just heard the keynote speech from our keynote speaker, and we are moving now into the plenary session. And we have two plenary speakers who are also seasoned speakers, seasoned pharmacists from other areas of pharmacy practice. I had already said earlier that this conference boasts of speakers. We flaunt speakers who we have, carefully chosen from every area of pharmacy practice. And we are going to be having the plenary session with two of such speakers. Let me just quickly mention that we are required to rename ourselves. For those who have not done that, we just require you to add a suffix to your name for the breakout session. Ideally, it's going to be kind of automatic, but we just want to have that as a plan B, just in case you are having any challenge joining any of the breakout rooms, so we can manually add you to the breakout room of your choice. And we'll be able to do that only if we know which of the breakout rooms far and wide and presented over 100 scientific papers at conferences and published over 120 papers in journals of international repute. This has earned him visiting an adjunct professorship to universities both within and outside the country. As a mentor, he has successfully supervised and graduated 8 master's students, over 25 fellowship and postdoctoral students, and is currently supervising 6 postgraduates comprising master's and PhD and 10 fellowship students. Professor Wanang has held positions of responsibility at the Bayero University and the University of Jos, Nigeria. He has served as external examiner and assessor for professorship catered to several universities within and outside the country. He has also been conferred with various awards locally and internationally. He's a man of diverse interests. It will interest you to know that he also holds an LLB degree in law. Ladies and gentlemen, distinguished conferees, I present to you Professor Noel Wanang, a mentor, an erudite academic with an array of superlative achievements. Prof, sir, you're welcome.
I thank you most sincerely, Dr. Ugochukwu. It's a beautiful day. I must first of all commend my Oga editor, Professor Kunle, who had an excellent keynote and a perfect delivery, a very fantastic delivery. I felt ambushed that I have to speak immediately after Professor Kunle. It could be a deliberate way to humiliate me. While he was discussing, I had prayed to my God that God save me from this embarrassment to speak after an erudite speaker and an astute researcher and academic. Again, I must commend the University of Lagos. As usual, Lagos is always setting the pace. You have done fantastic. You have done very well to have brought all of us together on such a fantastic occasion. My job is simple. I am to discuss today on post COVID-19 and the new normal in research. With your kind permission, let me share some slides with you.
Please go ahead, Prof.
And I will seek your indulgence too to switch up the video so that we can have a good clarity of my discussion, if it is okay by you.
Feel free, sir. Feel free to do that, Prof.
I'm waiting for the screen to... My screen sharing is paused. Is it possible that maybe It is from you, the host.
No, we've made you a co-host. You should be able to share your screen.
Okay, but you know, technology these days could be embarrassing. Yeah, it's there now. My slide is there. So my topic today is an interesting one, post-COVID-19, the new normal in research. Take it or leave it. COVID-19 has come to stay. And if COVID-19 has come to stay, what do we do as scientists? What do we do as researchers? What do we do as academicians or people in training? I want to appreciate your officials. All the way, you thought of somebody all the way from Jos to have a discussion in this. But so far, with all the front and back on COVID-19, what have we learned? I think it's a very interesting scenario for us to have a think back on what we have learned. As a country, it will interest you to know that the country had started the production of vaccine as far back as 1925. Interestingly, within this week or last week, Nigeria got this batch of COVID-19 vaccine. If we started production of vaccine in 1925, and as late as 1952, we were able to develop yellow fever vaccine, 1945, we were able to develop rabies, anti-rabies, and as late as 1987, the country was still into the production of vaccine. Then what happened? Sometimes in 1991, the industry in Yaba was closed because they want to go into renovation or upgrading, according to what the theoreticians said. And that was the end of the story till date. That place has not been opened again. The only place that we have now that is into vaccine production is probably the National Veterinary Research Institute in Pharm, Plateau State. Then the story is, what have we learned? To me, COVID-19 is a blessing in disguise. Hospitals were absolutely dead, moribund. Hospitals were not functional. The good thing is the politicians cannot fly out. The money bags cannot fly out for medical treatment or medical or jamboree. Everybody had to now fall back into the country. And that, at a certain point, changed the dynamics in our hospitals. Facilities were bought, drugs were injected. I know of instances where people have died because of ordinary ventilator. There are some facilities about 1 million naira or something like that. Yet people died. Well, what?
Prof, sir, sorry to interrupt you. Prof, sir.
Yeah.
Apologies. So sorry to interrupt you, but we are not seeing your slide very well. Like something is obstructing it. So if you don't mind, we can share your slides from our end.
Please do. Please share it from your end.
Okay. Yeah, because it's actually blocking a lot of the contents of the slide.
Okay, let me switch off mine then.
Yeah, the slide is up now, so you can go on.
Okay, fine.
All right.
Thank you so much. Now, let me give you a brief on the Plateau story. Incidentally, I was made the chairman of the Plateau State Research Committee on COVID-19. It was a Herculean task at the beginning because when we started, we had a lot of challenges. The COVID-19 has brought a lot of changes into research. Some sects initially believed that research on diseases or drugs was sacrosanct to them. Incidentally, I was given the chairmanship, and of course, like any other situation, the first challenge I had was from the medics because they felt that a physician should have been the person that should man such a sensitive position. Be that as it may, after all said and done, we were able to weather through the storm to arrive at what we are today. Indeed, the research team, we even lost one of us, Professor Jacob Kolawole, who died after, sometimes in January this year. Well, the bottom line is, at the end of the day, the Plateau State research team made a recommendation of both conventional drugs and herbal drugs. Like Professor Kunle said at the beginning of his keynote, we are sitting on a lot of opportunities here in Nigeria, but we don't value our own. We have unfortunately fine-tuned our mind, a mental slavery, to believe that we need everything imported or information must come from the Western world before we accept and say it is good. At the conventional drugs, incidentally, the same ivermectin that he made a recommendation to his team, having read some journals from Australia, we equally read a lot of information and found out too. The chloroquine, hydroxychloroquine, the ivermectin could be effective in the treatment of coronavirus. And we actually made a recommendation. That was sometimes in June, July last year. But how did that end? The entire thing just ended on the tables. They didn't believe it until one day the white man came again and said, yes, ivermectin could be useful in the treatment. And so, things came up. And now we are revisiting the same ivermectin again. Same thing we are facing in the herbal remedy that we have formulated, which we were able to make 3 formulations out of the herbal remedy for severe, for mild, and asymptomatic. And we are ordinarily supposed to have gone into the clinical trials, but we are waiting for a lot of protocols on regulatory agents. However, it is interesting to know that at the end of the day, we are making a headway. The whole world is looking out to us, pharmacists in particular, that we should come out with something that will cure this pandemic here. Now, coming back to research, what has COVID-19 brought into research? Like I told you, when we started, when COVID-19 came into Nigeria, the entire hospitals had nothing to tell you. Patients were dying, ordinary ventilators were not available, oxygen facilities were dead, even the drugs were not available. But we may say in quotes that we thank God that the COVID came and exposed our eyes, and for the first time in the history of the country, to research was given an attention. Nobody would have thought that Plateau State government would have inaugurated a research team of cracked researchers from the university to look into this disease. Nobody would have thought that TED Fund will divert or invest a huge amount of money into research. Nobody would have expected Central Bank of Nigeria, Shell, and some other mega big companies in the country to invest into research. But these things have changed. This shows that we have to look inwards. It is interesting that despite the numerous quantity of professors we have in this country, in the pharmaceutical world, research or drug formulation or drug production is a big problem. Not that the professors cannot do it, but because the level of preparedness of this country, our attention, our priority is actually not on research. So this COVID-19 has now made us look inwards, so that we can have the best use of the professors that are among us, of our researchers in our facility. When we started research in those days, people were operating in silos. Those in pharmacognosy would operate quietly in pharmacognosy. Those in pharmacology will operate quietly in pharmacology. Those in pharmaceutics or formulation like that, were operating in silos. We did not think of a blend, but this COVID-19 has exposed us a lot that we know that is the weakest thing that we've been doing, working in silos. So we now need a collaborative research. Like I told you, I'm a pharmacist with a bias in pharmacology and toxicology. When I was made the chairman of the committee, I now realize that coronavirus is not all about drugs. We need to understand the molecular tricks of the virus. If it is so, we need people in biochemistry. If it is so, we need people in medical laboratory science. If it is so, we need people in microbiology. In fact, we even need people in the religious sciences, even if it means they're praying for us so that we can have a breakthrough into what we are doing. So it is a diverse work that we need physicians, we need people in public health, we need people in internal medicine, infectious diseases, we need pharmacists. Incidentally, while we're running all this, we even forgot to bring in the formulators. Until we got to a certain stage of our work, then we needed to formulate it into package. What formulation do we administer? What do we do? We needed to do the pharmacokinetics. We needed to do a lot of parameters on this agent. Then we realized our deficiency. We now started going back again to bring in people. What am I saying? Our mindset in those days was a mindset that worked in silos. But the mindset of the corona now has fine-tuned us into collaborative research and collaborative thinking so that we can have a blend, not just a blend within the system, but the blend should equally be translational so that we transmit from the gown that we're in to the town. The COVID is a global pandemic. Everybody is affected. We in the academia, how have we translated this to the community? So that also is another focus. What do we do that will best make the community to appreciate us in research? When Nigeria, or Africa rather, started this health world by the year 2020, if somebody should ask me, why did we fail in health world by the year 2020? I would say we failed because we did not connect to the patrons, to those that patronize herbal medicines, or to the villagers. We were doing it at a high profile armchair under AC, big armchairs, files and books. Nobody came down to the nitty-gritty so that we can relate with the local people at the rural areas. We relate with the end users of our drugs, then we know what their problems are. This again changed with the corona because we now have to reconcile what we have been doing in the academics with what is happening in the town. We've connected the gown and town, meaning the community became supreme because it is all about problem solving. Now, what have we learned again is that everybody is involved in this pandemicity. When it started, rumors came, conspiracy theories came, jokes came, a lot of humors were made about it. So many persons never believed that there is something like corona. In fact, the comedians in Nigeria did not have issues. They made fun out of it. And all those things were trajectory to changing people's mindset about the existence or non-existence of this virus. Now, if we know that everybody is involved, we have to also get them involved in the performance of our duty. And that is one thing that we have learned from the corona pandemicity. I've said it earlier, there was a lot of openings for research. We had openings from CBN, we had openings from TED Fund. As I'm talking to you now, my committee benefited from grants that we never knew existed. Openings came up. State government never had any research grants or research in their budgets. But with this now, it is also going to change the national dynamics. They are going to look into research, into sponsorship of research in their next budget. This goes to see government is now involved in our research. Government is now eager to see what we do. If it is so, there's a need again for those in research to have a connection with the industries. Like Professor Kunle said at the beginning, truly, there is an absolute disconnect between industries and the academia. The academia is busy into research for publications to end promotions. The industries are busy into a so-called R&D with the sole target of making profit. If there was that connection between the two, Nigeria will have found a lot of breakthroughs. I remember the NIPRD, which Professor Kunle was part of it, and a lot of other academic erudites in NIPRD. How did it end? Now back to the corona. Corona again is an opening that we should be able to have that bridge. We should be able to have that connection. We should be able to have that government involvement. Once there's a will, I can assure you there's a will. The corona has opened the will now to government. Each time you mention an opportunity for Corona-19, remember when Corona-21, which ordinarily looks like a new strain, government should be able to make trajectories, some projections now so that what happens if there's Corona 2025? What happens if there's Corona 2030? We should be able to start making plans now. We should be able to strategize now. What do we do to avoid that? Unfortunately, Nigerians have been mentally enslaved to be importers, to be consumers. I can tell you in good authority that even the manufacturers that we're having, it is so-called manufacturers because none of them really manufacture. Everything they do is importation of raw materials and compounding the raw materials into formulated products. If you ask me, I'll tell you that the only thing I know Nigerian pharmaceutical industries do not import probably is water. Any other material is imported. If it is so, government has to put a lot of input into the pharma industry from the production, from the industries, to the research. There should be a connection with that. If there's anything we have learned also with the COVID-19 is the ICT digitalization. This meeting we're having is a Zoom meeting. Ordinarily, we will have converged at the University of Lagos to have this conference. But for Corona, we now have a Zoom. For Corona, we have utilized absolutely our internet services. We have improved on our ICT. Lectures can now go on. I could remember recently I had lectures on pharmacokinetics with my MSc students, and we did it on Zoom. Apart from that too, it has also opened ways for very simple ways for research. You can sit in the comfort of your house, sit in the comfort of your offices, deliver lectures to students, activate your email, communicate, get recent publications online and recent academic books so that you can enhance your core work. Most importantly, Corona has brought problem-solving issues to us. When Ebola started some time back, Nigerians did not do much into the preventive measures, so looking about the future. But thank God, we were able to surmount it. We appreciate the NCDC for a quick response into that. I hope you also know that the Ebola has suddenly reemerged again some 2 weeks ago in Guinea, claiming about 5. A system should be put on ground with the experience of the corona so that if there's any infectious overtone, we should be able to quickly see what we can do. We should be able to have a focus. We should be able to look at what can we do to solve the situation per adventure it occurs. In summary, coronavirus has made us to be result-oriented. We now have diverted attention to this corona because of the havoc it has caused in the system today. Looking at herbal medicines, for instance, we have long neglected herbal medicines. Herbal medicines are low-hanging fruits. Like Professor Kunle said, we have been doing it in the same traditional way that we have done it 30 years ago. And that is why it has not been able to face recognition. Albert Einstein will tell you that if you do the same thing repeatedly and you expect a different result, it's a sign of insanity, which invariably means we have been doing the same thing over time and repeatedly, and we're expecting different results. That looks like madness. We know GNLD, forever living products, and so many foreign products came in from natural sources, but they are really catching fire. They are spreading around. They are being sold. And money is spinning out of these issues. What about our own herbal remedies or herbal medicines here? Probably we should change. I must confess to you, my team in the Plateau State, we did not approach our herbal medicines in the archaic, conservative hotpot that people may think. We have about as much as 13 publications from international journals, 3 on literature search, and then the remaining 10, all on our results. We have even gone ahead to do the pharmacokinetics. We've tried pharmacokinetics on animals. We've done parallel studies also on humans. What am I talking about? What I'm saying is we should try to have a change of concept from the archaic way of our herbal remedies to a new accepted one, because that is the only way that we gain acceptance. I was able to connect with some countries, Congo DR, I connected with Zimbabwe, I connected with Uganda, I equally connected with some other countries based on the results that we got from Plateau State. Meaning the COVID-19, the normal thing we're going to have now is by the time we go into deep research and responsible research and research, state-of-the-art research, we are going to have connection, we are going to have collaboration with people outside. A lot of persons are waiting. People are eager to see what we do. This is a slide to show you the numerous pictures of the things that we have from the plants that we concocted on the plateau, but we are not taking it the way it is. We are not taking it the way it is. We have gone further ahead so that we can make a difference. What are the prospects? Herbal medicines, I must tell you, we are living on a bunch of wealth. We have the treatment and cure of this, coronavirus, but we need to just go deeper and look inwards and explore more in our research. Post-COVID-19, our research CV, our curriculum vitae for research will expand because a lot of persons are now interested in what we do as Africans, as what we do as Nigerians. I must commend a group of researchers that I have read about. I've read about people in the UNILAG. I've read about people at Christland University, where Professor Babalola is. I've heard about IFE. I've heard about some other pockets in Suka, Meduguri. Some pockets of universities are coming up. That is a beautiful thing. By the time we continue this collaboration, let it be inter-university collaboration, eventually let it be a national collaboration, eventually we'll come up with something that the whole world will celebrate, that Nigeria, pharmacists in Nigeria, people in academia have come up with something. If we look at the prospects again, after COVID-19, our economic values will increase, investment opportunities abound, research is a huge investment. Then we know too that agricultural development will increase because most of the plants we get are from natural sources. Our local farmers will get engaged. They will plant these our crops, cultivate them, and at the end of the day, income comes in. Employment is a thing of the past because several persons will be engaged. Most importantly, our educational spectrum will change. And like I would say, our position as pharmacists, our position as Nigerian researchers will be on the world map of science. Again, you cannot downplay what collaboration will do. You cannot downplay what networking will do. Post-COVID-19, our collaboration will expand from intra and interprofessional, and then to other sectors of health. The physicians will come in, other health professionals will come in. We go to production, and the expansion is endless. Networking is something that you cannot say. Financially, we are going to be richer. Facilities, laboratory facilities, reagents are going to be available, provided we explore these COVID-19 opportunities, because like I told you earlier, government is really, really interested and involved because, like I said, COVID-19 is a blessing in disguise. They cannot move. Everything is now with us. The sky is our limit. To make or to man. To end this discussion, permit me to say this. To the world, you might mean one person, but to one person, you might mean the entire world. As researchers, what you are doing, your quietness in your laboratories, once the results have clicked and you have a positive result, I can assure you, you are solving not just a problem, you are solving the entire mankind's or entire generation's problem. Meaning, people can look at you as a person, somebody that is desperate, that needed your laboratory outcome. The moment your results are out and in the positive, I can assure you is a thing of celebration for not just you, but for the entire world. Again, permit me to congratulate University of Lagos for a fantastic workshop. I appreciate you one and all for this opportunity given to me and my research team to showcase what we have done. I thank you very much, and God bless you. Have a peaceful deliberation as I await your questions or anything that must have been provoked to my presentation. Thank you very much.
Thank you so much, Professor Wanang. A big round of applause. Applause for Professor Wanang. That was a very expository presentation on the new normal in research. So Prof has been able to make us to understand the need for collaborative research as part of what the COVID-19 has taught us. He started first of all by sharing his experience in Plateau, in the committees. He worked the different research that he was involved in related to COVID-19 and even his past researches. He went ahead to tell us that that COVID-19 has made it very important for everyone to have, like a mindset reset, We need to have a mindset of collaborative research and thinking in order to have a blend. And then he also made us to, understand some things that the new normal in research presents. Things like us looking inwards, collaborative research, no more silos. We should focus on translational research. And it should no longer be just, practical or just talk, but there should be performance. It should be from pandemic to performance. He also made us know that there is more door openings on research, more funds, more grants or research funds from bodies like the TED Fund. we should be expecting a lot of government involvement, a lot of digitalization, like the conference we are having now, which is made possible as a result of ICT and digitalization. Program research, we should be result-oriented. Then he concluded by stipulating some prospects for this new normal. Prof, we want to say a very, very big thank you for sharing with us from your wealth of knowledge and experience. And I tell you that you have indeed left us with a lot to ponder on. Thank you so, so much. God bless you. Thank you.
Thank you, ma'am.
Thank you. So it's still the first conference, scientific conference of the Faculty of Pharmacy of the University of Lagos, the university of first choice and the nation's pride. We welcome all those who are just joining us. I don't want to say that you have missed a lot. If you missed the keynote speech, well, I hope we're going to be getting a recording of this conference so that you'll be able to catch up on all you have missed for one reason or the other. So we'll move to the second plenary speaker. Like I told you earlier on, we are flaunting a host of seasoned speakers from all walks of pharmacy practice. And our next speaker is another giant from the pharmaceutical industry. He's no other person than pharmacist Ignatius, popularly called IG. Permit me, sir, to call you IG, popularly called IG Anuku, who is currently the National Chairman of Industrial Pharmacists of Nigeria, NIPRD. So IG Anuku is the National Chairman of the Association of Industrial Pharmacists of Nigeria, where he leads national advocacy for the establishment of pharmaceutical manufacturing parks in Nigeria as a panacea for unleashing the Nigerian pharmaceutical industry. He holds a Bachelor of Pharmacy degree from the University of Nigeria, Nsukka, and a Master of Pharmacy degree in Clinical Pharmacy from the University of Lagos. With over 25 years of experience in the Nigerian pharma industry, IG has a track record of leading innovation through planning and successful implementation of business strategies. He is currently the Chief Operating Officer of Alpha Pharmacy, a wholly indigenous renowned pharmacy renowned for providing rare ethical pharmaceutical products across the length and breadth of Nigeria. Alpha Pharmacy and Stores Limited also operates a retail chain across the country where IG is achieving corporate goals through the development and motivation of people. Prior to joining Alpha Pharmacy, IG has recorded outstanding performance and leadership in diverse roles of increasing responsibility in the industry through formulation and implementation of sales, marketing, brand planning, and business development strategies to drive revenue growth. IG Anuku is a Merit Award winner of the Lagos State Pharmaceutical Society of Nigeria. He has served the Pharmaceutical Society of Nigeria in various capacities and is at present a member of the National Executive Committee and Council of the PSN. IG is a member of the International Pharmaceutical Federation. He's happily married and their marriage is blessed with children. Ladies and gentlemen, I present to you pharmacist IG Anuku. You're welcome, sir, for your speech. Thank you.
Thank you very much, Dr. Ogochukwu Ameze. Just the way Professor Kunle was happy when his name was pronounced properly, I'm sure you'll be happy. You're doing a very great job, and I thank you for welcoming and introducing me. The Vice Chancellor, University of Lagos, Professor Gundipe, ably represented by the DVC Academics and Research, Professor Famidoni, the Dean of the Faculty of Pharmacy, University of Lagos, Professor Ajayi, the Chairman of the Central Planning Committee, Professor Adepo Jubelo, the keynote address speaker, Professor Olobayo Kunle. So you did a very wonderful job at your presentation. I'm happy to be speaking after you. Distinguished professors and other of pharmacy and other disciplines here present, fellow distinguished panelists, distinguished men of honor, gentlemen of the press, I hope they are here at this first scientific conference. Ladies and gentlemen, when Professor Wanan was about to start, he said he was gently praying when the orator, Professor Kunle, was delivering his keynote address, because he was going to speak after Professor Kunle. You cannot imagine my plight, speaking after Professor Kunle and Professor Wanang. I must have been praying doubly to do that. I'm happy that their presentations have really prepared the ground for mine. And let me start to share my slides, because their presentation have helped to kind of define the pharma industry in Nigeria, and also shed some light on what is happening presently and what we need to do. So since my own topic is on emerging role of the pharma industry, we'll rely a lot on what they have said, and I will make a few references to their own presentation as we go on. My name is IG Anuku, and thank you for inviting me to present at this conference. And I must commend Professor Ajayi for choosing Professor Adepoju Bello, to chair this conference. I think you know that to get the job done, you have to choose the right person. So my respects to Professor Bello. Okay, so I will move right ahead. We are using technology to bridge the gap. We are not traveling as we would love to travel. The transport industry and the tourism industry, more or less, have been hit. We have huge losses. We lost lives, we've lost money, we've lost a lot of things. Some people have lost their minds because of COVID. There are a lot of disruptions in the supply chain, for pharmaceuticals and for many other things. In fact, as we are doing this conference, I remembered something that was like a joke in the social media, where there was this post that said that after COVID, or during COVID as it were, that very soon you'll be seeing the impact of COVID on social sciences, the impact of COVID on political science. The engineers will say how COVID-19 has changed engineering. The architects will say new designs post-COVID. So that is what COVID has brought about, and you see all such things happening. Okay, this COVID is actually a milestone, a landmark. I'm sure that as we progress in the years to come, this era will always be cited. We have seen also the positive sides of COVID, just like the earlier speakers have mentioned. We are now using technology the more. The systems are being strengthened, especially like the health system, they are being strengthened. So all of these are the consequences of COVID-19. But also we need to look at the ramification. And indeed, the import of COVID is that there is scarcely any field of human endeavor that COVID has not touched. It has touched practically everything. But for the purposes of this discussion, I've chosen these four aspects to look at, in order to push forward the topic of this presentation. So economically, for example, we see at the onset of the COVID some countries going into recession because revenues have been affected, and many countries had to spend hugely on health and other things as relating to the COVID in order to save lives and in order to get a hold on the pandemic. So there was huge import economically. At the individual level or at company level, institution levels, a lot of jobs were lost. Okay, so impacting the economies of families. And we recall that many countries, Nigeria too, US, we had the palliatives, we had all of that, being, countries trying to solve this problem by giving palliatives to their citizens. Politically too, there were a lot of fireworks. At the outset, the President of America, President Trump, was blaming China for the pandemic. It was a lot of furor, trying to blame China for not doing enough to stop the pandemic and for hiding figures. Of course, eventually, America decided to stop funding WHO. These are all the things we know. These are the things that happen in the political arena. EU and some countries also blame China, and some are seeing it, conspiracy theories have it, that China, came up with this virus in order to disrupt economies, and they themselves had already planned how to quickly, contain it and be better off. And as we could see, at certain points, when the economies of some countries were being hit hugely, China recovered and started to pick up. So this political face-off was also there. We saw a lot of borders being closed. All countries more or less closed their borders. And, a lot of things happened at that time, at the first wave. And again, politically, it could be something that, would be of interest to argue whether Trump actually lost the election in America because of COVID or not. But we recall that sometime at the mid-2019, his government was being rated, to be very successful because of the jobs that they have gained, because of the economy blossoming. And it was like a sure bet that he was going to win the election. But with COVID, he didn't manage it well at all. And, eventually he's lost the election. China, at the same time, was trying to look good, okay, in order to dispel the mindset that China was, responsible for all the issues. So China began to do a lot of, donations of PPEs and all of that to many countries. So socially, as we have said, no gathering, restriction of traveling. There was a lot of lockdown. We saw so many images during the lockdown of especially airports, very busy airports, where you have a lot of planes being packed and nothing was happening. There was ban on exports of health commodities. That is when it comes to health. Many countries began to save what they had for their citizens. And Nigeria was affected too, because most of our imports coming from India, we had many of those products banned. Of course, because it was a pandemic, there was a lot of mortality. There were challenges to health systems. And this is very, very instructive to note that many countries that had prided themselves of having very wonderful healthcare systems came crashing. And this is one point that Africa will continue to thank God. That's the spiritual aspect of it. While we have survived, nobody has yet, come up. But we have a set of speculations. Why? Was it because of the immunization program? Is it because of the being in temperate region or temperature? Is it because of how we have handled Ebola? I also came up with the idea that perhaps we use a lot of soap in Nigeria, but Nigeria is not all of Africa. We have a culture of washing with soap. So maybe we were washing off the viruses even before they happen. So all of this happened, even at the spiritual level. Many people were blaming, were saying that God was, punishing humanity. Some people were saying that there were conversions and all of that. So there were huge ramifications for COVID. And the individual at that level, there are so much stress, there's a lot of fear, being brought about by this COVID. So we move on quickly. So what has this done? Intervention funds came in to pharma industry, just like Professor Kunle and Wanan has spoken about. But here in the US, in India, we had a lot of things happening. Sorry. So the intervention funds, every country, came up with intervention fund. In Nigeria, the CBN came up with theirs. We know that a lot of APIs are being manufactured in China. So when this happened, it affected a lot of countries. So right now we are seeing many countries scaling up. India, for example, that gets about 70% of their APIs from China, has now started a very huge initiative, and the government has of President Modi has set aside $1.3 billion to help India shore up their APIs production, although they are good with finished pharmaceutical products production. But right now, every country is thinking forward. Yeah, Nigeria is thinking forward, and we hear some of the intervention funds that are also taking place in Nigeria. Search for alternative sources of finished pharmaceutical products is happening now, and this is where Nigeria stands a chance, like many other countries. Countries like the US are trying to search for other places they can get quality assured medicines, because most of the supplies are coming from China and India. And now, because of the pandemic and the effects of it, there is a lot of need for them to look at elsewhere to get finished pharmaceutical products. And as we have all noted, the positive side of the COVID is that there is increased research and development activities. Okay, so this is also like a benefit for the pharma industry, an industry that's more or less forgotten in Nigeria now and is getting quite some attention. So now we'll look at the emerging roles for the pharma industry, which is the topic for today. The pharma industry traditionally is playing the role of researching into medicines in order to, either cure diseases or manage them. And the industry will continue to play that role. But today, we are seeing some other roles that are not traditional roles, coming up for the pharma industry. And I think this is what this conference is all about. Now, every government, the role of every government is to provide for her citizens and to defend her citizens. Now, the pandemic has, brought more into focus the right of the citizen, right to life, right to good healthcare. And COVID has been a threat to many nations, especially because of the loss of lives. And just like the Ebola experience, which was an African issue, was an epidemic, mostly in the West African sub-region. And when it happened, nobody paid attention to us. Okay, but this COVID is catching the attention of everybody. At the time that the COVID, Ebola was happening here, we all heard the news that yes, there was is it cure or vaccine for Ebola in the America, but they couldn't send it to us because they're also keeping it for their citizens. So in this pandemic and in this era, the word frontline, which had been a military word, is now being applied to the industry, healthcare sector, as it were. So today you hear those are the frontline. Those are the frontline are the healthcare professionals. And now when you talk about frontline in military parlance, you also talk about logistics, because the frontline are those who are at the war front, firing the bullets. And then before you get to the front line, you now have the logistics, those who are at the back supplying the ammunition, and also looking at how the war is going and deciding which kind of arms that are most essential to win the war. So today we find the pharma industry as the logistic arm of this war. So because of the gravity of security, the issue of talking about national security, we are now talking about medicine security. So in this context, you find the pharma industry becoming more of the part of a security architecture of many nations. So this is one role that we must begin to see, that just as you find out that, like in Nigeria, when you look at our budget, you find out that defense takes a lot from the budget. If you look at research internationally, you look at like a country like America, America spends a lot in research of arms, just like UK and many other European countries, and even lately India and China, of course. Okay, so we may begin to see that the pharma industry will begin to get this kind of attention. Now and again, we look at what we call a show of international status. Many countries now, you look at and say, right now, who has the best pharma industries? Okay, it is something to be, to talk about for status. Who has the best supplies of vaccines, best supplies of medicines? It is a status thing now. And when you look at it, you find out that the countries that are emerging in this are also more like the countries that the superpowers of this world are also the countries that are in this mode of international status, okay, and relating it with the pharma industry. Who comes up with the vaccine first? And in this, we can ask, is it America or is it Russia? Who came up with it first? When Sputnik came, it was being criticized and not that it had not gone through phase 3 trials. Today, the Lancet publication shows that it's doing well. But then, when Pfizer came up with her own vaccine with BioNTech, it is the first vaccine. So it is also a matter of international status. Who got it first? Which country is leading? Okay. So now we see that in, let's say, 2019 and backward, you see many military maneuvers happening. Sometimes you see Russia, having maneuver, showcasing their military might. Nothing. National diplomacy. We should be asking ourselves today, for example, what happens if any pharma company or any researcher comes up with a cure? Today, we are having a combination of drugs that have been repurposed to manage COVID. Which company of which country comes up with a cure for COVID first? These are matters of international status. And then another thing that for example, military power, as we have said, the US, China, Russia, Israel, all of them have something to say about that. Sometime not too long, as we are having the tech world, artificial intelligence, blockchain, and all of that, we are looking at high tech. Which countries have this high tech? We look at countries like China, India, Israel. Okay. Also, we look at what countries used to, for pride for themselves. We look at youth, sports, entertainment. For example, everybody knows what Brazil is known for. At least what Brazil takes pride in is their football. Argentina too. We look at Nigeria at a time, Green Eagles, was something of a pride for the country. Jamaica, okay, look at sprint, look at boat, you look at reggae music. These are the things that the countries take pride in. But today, the pride of the nation is the pharma industry. That is what everybody is looking at. Which company comes first? Which company does it first? Now and again, all of this is culminating in a tool for national diplomacy. Today, vaccines are a tool for national diplomacy, and it's emerging, and everybody's seeing it. And in this first phase of it, it looks as if China, India, Russia are winning. Okay, so we will look at that in a bit of detail. So we move on to say that pharmaceuticals are now a serious issue of national security. And those who play here are the pharmaceutical companies. We'll move rather faster here. Now, this slide shows the imports of health products from China into the USA. And there is already a huge cry in the USA that they are so much dependent on China. This graph shows a growth over a period of 8 years of about 17% year on year of supply of finished pharmaceutical products to America. But what this graph is showing down here is saying that this problem is understated because US is much more dependent on China on supply of APIs. Okay, so US is shouting that they are having a national security problem because they are having medicines challenge. This one is something that I want you to look at. Here we are having, I picked this, I want to look for updates in the BBC, updates on COVID in BBC. And of course, they are reporting what vaccines are approved in the UK and what is happening. And interestingly, you see at the first column where they put company, they put the companies, but they are showing the national flags where these companies are coming from. So this is what you can, this is what interests me here, not just the other information here, that this is the pride of the nation. AstraZeneca is the pride of UK. Pfizer is the pride of America. Moderna is pride of America. You have Novas, so that's the way it's going. Many countries are looking at their pharma companies and they're happy and they're proud of their companies. Now I'll go back a bit. Sorry. In this, in another document, all right, this document, somewhere in the article, a mention was also made of Sputnik of Russia and Pharm vaccines from China, but they were not in this because they are not approved in the UK, maybe. But then their flags are not flying, as we can see here. So something that interests me too, as we are celebrating that COVID vaccines have come to Nigeria, it was a feat for us to get COVID vaccines into Nigeria. Indian Times, a newspaper in India, largely put on their headers, Nigeria receives made in India vaccines. So this is the way it's going. Every country is looking for something to claim and to show her power, her might, associating with our pharma industry. So we go to, sorry, I've gone back. Move on to the next. Okay, so here you have these companies. These are the 10 leading pharma companies in the world. And of course, obviously, America is in the lead. Pfizer is America. You have, of course, Johnson & Johnson, Advie, the American. Sanofi is France. Novartis and Roche are Switzerland. And then, of course, GlaxoSmithKline and AstraZeneca are UK. So now, this picture is a picture I'm sure many of us are familiar with. What's happening here? When the Americans were in Iraq to boost the morale of the citizens and to show the power of America, President Bush had to visit Iraq and he snapped this picture and many others with their troops in America. This is a show of strength. This is the president of America. He moves into a military war zone and he's there with his people, boosting their morale. And this picture was all over the world to show the strength of America. These are the ways the world showed, how their countries were strong. See the president of Croatia, Kolinda Grabar-Kitarović. We all remember this picture when Croatia was in the World Cup and the president, didn't go to sit at the VIP, but she sat with the fans because she was wearing jersey. And this was to cheer her country to victory. And this picture, made the headlines, and the news made headlines, how the president is associated with people. This is what is happening. How it is going, it's how it's happening. But today, what are we seeing? President of China is in a lab coat and is visiting the Academy of Military Medical Sciences in Beijing to portray himself as a leader firmly in charge of the people's war against COVID-19. This is how it was titled from where we picked this up. So this is the shift. This is the emerging role of the pharma industry. But also, when we say pharma industry, yes, let's also remember it's not an industry only for pharmacists. The molecular biologists, the biochemists, the microbiologists, many people are also playing in this field. But it is our industry anyway. It is the pharma industry. So we too as pharmacists must also rise to the challenge and rise to the occasion to really add value and to do our own bit here. What are we seeing here? This is President Uhuru Kenyatta at the center, gesturing during a visit to the Central Vaccine Depot in somewhere in Nairobi. It's all about the new role, the emerging role of the pharma industry. We are the logistics of this warfare. We are the logistics of this warfare. So the time we began to understand it and began to see how important this role is becoming, then we begin to add value. We begin to make sure that even in our own country, that we, fill this gap. Because if we don't, somebody else is going to fill it. No, nothing exists in a vacuum. If we don't fill it, other people are going to fill it. And like we all know, Nigeria is an import-dependent country. So if we don't do something fast to move this, I tell you, some other people are going to take it. Now, this brings, this is like a realization of fulfillment of what seems like a prophecy that Michel Sidebi made in 2012. At that time, he said, in the future, regional and global power and national stability will be determined not by who controls arms, but by who controls access to medicine. That's it. That's what's just happening. And because of the, fear of biological warfare, it is going to be more, because beyond getting vaccines to, control epidemics or pandemics, if perchance there is going to be biological warfare, who will win is the person who has the vaccines ready. Who has the vaccines ready, so that once such biological warfare weapons are released, like anthrax, it is those who have these vaccines ready to quickly deploy to their population. Those are the people that will exist, because everybody will deploy biological warfare unless there is one that is made for specific genes for some races. It's going to affect everybody. So the person who wins is the person whose country wins. So what are we seeing now? This is a headline that came out sometime last week from that we saw from AFP.
Famaiji, sorry to disrupt you. Famaiji, sorry to interrupt you.
Yeah.
Please, we'll need you to be like faster and like round up now.
Okay.
Can you hear me?
Yes.
All right, yeah, so that we can go into the poster presentations.
Okay, great.
Yeah, thank you, sir.
Yeah, so this poster says how vaccines become ammunition in global diplomacy. So it's already happening. So what I wanted to do, having looked at how this is evolving, is also to look at what is happening in Nigeria. Public sector, CBN funds, NIPRD and NIPRD has happened. AstraZeneca is here with us. NAFDAC is working towards global benchmarking so that they can register vaccine production plan. The private sector, a number of things are happening. So I'll try to round up with what NIPRD is doing to lead advocacy for improvement of infrastructure and work force development. Okay, we are working on a Pharma Park project. We already got a place in Tezi in Ebonyi State. And the whole idea of this Pharma Park is for co-location. Co-location is going to solve Ubuntu. That has the pharmacists and pharmacists. We should be able to start making exports to America and other parts of the world in order to improve pharmaceutical sector inputs to GDP, as Professor Wana had talked about. So how are we doing this? We're in discussion with NAFSA for workforce development, with FIP young pharmacists, we are talking with them to train. And then, just like Professor Kunle was talking about continuity, we are going to establish a pharma industry R&D fund to augment what we're already doing with NAPA. Also, the partnership with NAPA is happening. Please, if there is one more thing I have to say before I round up, is for the academicians in Nigeria, pharmacists, academicians in Nigeria, to accept that the industry and the academia are already discussing, but many of us are not joining that conversation. So please, let us join that conversation under the platform of NIPRD and NAPA. We have already got one product produced, which is NIPRD, and the polyherbal antioxidant cream, which is also a contribution from Unilag team of Dr. Meg Ilomwanya, is also under development. Hopefully by May, it will be there. So more conversation should be happening. And NIPRD and NAPSA are already planning to set up a center of excellence at the park so that research can be done, pilot production can be done, and we can move on and beat our chests that we have joined this race. Thank you very much for your time.
Thank you so much. A big round of applause for from IG. You know, he's from IG is an orator, so he likes, you know, laying out his points very, very well. So we want to thank you so much. He has taken us through the emerging roles in the pharmaceutical industry. He took us through the non-traditional roles, recognition of the pharma industry as frontliners, and pharmaceuticals as a tool of national security. He's also taken us through all that both the public and private sector, the involvement of the public and private sector at this time of the pandemic, and also honed down to what the National Association of Industrial Pharmacists is doing, with especially the Pharma Park project, which is like a co-location for different pharmaceutical industries, and it's going to be like a pharmaceutical manufacturing hub. That is a lot. So we want to thank you for your time, for, you know, telling us and sharing your experience with us, also letting us know the emerging roles that we should be expecting from the pharma industry at a time like this. Thank you so much. God bless you. We're moving on. It's been an interesting time, I can assure you, and I'm sure you also feel the same way. We'll take questions and answers now for our plenary speakers and the keynote speaker. But due to time constraint, because as much as possible, we don't want to keep you waiting for so long. We understand very well that this is a virtual conference and sitting pews can be quite challenging at times. So we want to manage our time very effectively. So we'll be taking only 3 questions, If we have more than that, you may type in your question and we'll get our plenary speakers and the keynote speaker to respond, and we'll get across to you somehow. So please, if you have any question, kindly indicate by a show of hand. The first 3 hands that I see would have it. Let's see. Yeah, I'm seeing Dr. Danjuma. Please go, I want to unmute you now, so you go ahead and ask your questions. I can only see Dr. Danjuma's hands raised. Am I seeing any other? For now, only Dr. Danjuma. So we'll go ahead and take his question. Please introduce yourself and who you are directing your question at.
Okay, good afternoon.
Okay.
Good afternoon.
Good afternoon,
hello,
sir.
Can you?
Good afternoon, sir.
Good afternoon, sir.
Yes.
Sorry, I'm directing my question to Professor Kunle. Hello, can you hear me?
Yes,
hello?
we can hear you.
Yes, I can hear you. Please go ahead.
We can hear you. Go ahead.
It's more or less like the presentation anchored on health system strengthening and then the pharmaceutical space. Actually, the truth of the matter is that when you are presenting, you talked about you are not well versed in the field of health systems, which you ended up making your presentation sound as if you are one of the health experts. The truth of the matter is that in health system, sorry, let me introduce myself. I'm Dr. Danjuma, a health system strengthening expert. and a health financing consultant. I'm also a clinical pharmacist. Health systems virtually depends on pharmaceutical products, whether we like it or not. And in health systems, we have the 6 pillars or the 6 building blocks of health systems, of which one is the supplies of medicines and the health commodities, which the pharmaceutical space is already being anchored, because without the pharmaceutical space, which is one of the pillars or the building blocks of health systems, the health system cannot thrive. And for us to be able to have the health system strengthened, the pharmaceutical space have to be up and doing. And in your presentation, you outlined so many strategies in which we are going to achieve that. One of which is there is no direct linkage between the academia and the practice space, which is the health facilities or the health space now. So until maybe those of you in the academics will try to, because whether we like it or not, the product we are producing in the academia is to feed this space. And until we see it from that perspective, you see so many of our colleagues that are coming out from the academic space finding it difficult to even link up with what, because the system now is in dire need of pharmacists. Because without even the product, not even to talk of the usage now, because the main problem that the health system is also having, or the challenge, is even the proper use of this product that is being turned from the pharmaceutical space. So the presentation is so timely, and I will encourage the academic space to kind of have a link, in as much as you have a link with the research and development with the industry. The industry, in my own by my understanding, is the health system space, which is the facilities that end up using this product. So it's more or less like an eye-opener for us to be able to integrate and then collaborate and work well if we must have our health system strengthened. Thank you once again for those presentations. I don't know whether we'll have the presentation so that we can also go through it, because having it online like this. So I'm speaking or contributing from National State, Nigeria. Thank you.
Thank you so much, Dr. Danjuma. I'm not sure you asked any questions. I think you just made some suggestions. And
exactly.
So we have a question in the chat box. So the question is to the keynote speaker. It says, one inherent problem in Nigeria remains the action and inaction of political actors in the allocation of funds for R&D. How do you propose that can be surmounted, sir?
Well, thank you very much. In the course of my career, I've had to deal with the politicians. I've dealt with the legislators. In fact, there was a time we had a pharmacist who was chairman of the House Committee on Appropriations. That's as high as it goes. And then I had several discussions with him. The point is, these are Nigerians like us. What you want is what they want. And then what you want off record is also what they want off record. I think the point is we've got to do advocacy. They have a lot of pressure on them. Let's be realistic. You remember in the presentation, I mentioned our slice of the GDP is actually very small. They also answer to all the other 98% of the GDP. So there is the competition for insufficient resources. We understand ourselves, but I think we spend too much time talking to ourselves. We have to find a way of talking to these people consistently, respectfully, in their own language. You see, the unfortunate thing is that our pharmaceutical science sector is totally university academia based. I mean, the mere fact that I'm a professor does not make me a good advocate in talking to politicians. It does not make me know how to convince a politician. So some of us will need to develop those skills. I see a number of us, especially amongst pharmacists, who have that skill. I mean, look at the MC today. If she's not a pharmacist, she could as well make fantastic living doing what she's doing right now. So we need to identify such people and encourage them. allow them to also grow in their career while growing that, because we need to create a subgroup whose major drive will be advocacy. We have to convince these people, and now we have this narrow window of opportunity. This COVID-19 pandemic, like IG mentioned, and Professor Wanang, the metal is hot. There's nothing you say about drug development today, health research, that this whole country will not listen. So let us quickly find a way of turning this into an advantage so that, again, we don't waste this crisis. So it's advocacy, engagement, respect, learn their language and speak it consistently. Thank you.
Thank you so very much for that response. Advocacy, respect, and all that. I'm sure the question was adequately responded to. I am not seeing any other question in the chat box for now, but if you have any other question, you can drop in the chat box, and then we'll have a way to get our speakers to respond, and we'll get across to you. Once again, I want to thank our keynote speaker and our plenary speakers. You guys are awesome. You are wonderful. We appreciate you. Thank you so, so much. There is no conference without research, presentation of research, poster presentations, oral presentations, and we are moving into that segment right about now. So out of all the abstracts that we have submitted for presentation, for each area, like the pharmaceutical chemistry, clinical pharmacy, and all that, one abstract was selected for oral presentation, and we have 2 for today, and which is day 1 and 3 for tomorrow. So we'll be moving straight up into the oral presentation. It's going to be actually pre-recorded videos, which we would play, and we will listen and note your questions. Immediately after the videos have been played, the speaker, the representatives, or the presenting researchers or the corresponding authors would come on board to take any questions that we may have concerning their research. I also want to quickly welcome Professor Adeboye Adejare, all the way from the United States of America. He's one of our speakers for tomorrow. We appreciate your waking up so early to join us on this conference. Thank you so much, Prof. So we'll move straight up into the oral presentation segment. Please listen very carefully, note your questions. Immediately after the videos are being played, the authors will come on board to take any questions that we may have. Thank you.
Abstract 47. Exploring phytochemicals as potential lead compounds for COVID-19 drugs using the concept of in silico studies, presented by Ahmed A.H. Since the beginning of the COVID-19 pandemic, continuous research is being carried out worldwide with the aim of developing therapeutics and vaccines, but little success has been reported to date. In silico studies can be used to screen phytochemicals as potential protein targets of COVID-19. In this study, phytochemicals that were reported to have antiviral activities were explored for their potential to serve as lead compounds in development of COVID-19. A systematic literature search for phytochemicals with antiviral activity was carried out using search engines such as Google Scholar, PubMed, and ScienceDirect. The 2D structures of the phytochemicals selected for this study were retrieved from PubChem database. The Swiss ADME tool was used to predict the pharmacokinetic and physicochemical parameters of these compounds. The physicochemical parameters were screened based on the Lipinski rule of 5. Phytochemicals with satisfactory pharmacokinetic and physicochemical parameters were selected. Crystal structure of the novel coronavirus main protease was retrieved from the protein data bank. The crystal structure of the novel coronavirus main protease and the 2D structures of the selected phytochemicals were imported into the Pyrex virtual screening tool. An orthodox Vina was used to carry out protein ligand docking simulations. A total of 176 phytochemicals were obtained from the literature search, but only genistein, rein, coridine, epigenin, and curcumin passed through the pharmacokinetic and Lipinski rule of 5 parameters that were set for this study. The results of the physicochemical properties were characterized based on the Lipinski rule of 5, which states that an orally active drug must not violate more than one of the following criteria. It should have not more than 5 hydrogen bond donors, not more than 10 hydrogen bond acceptors, molecular weight less than 500, log P not greater than 5, total polar surface area not more than 140, less than 10 rotatable bonds. All the above compounds clearly satisfy the Lipinski rule of 5. For the pharmacokinetic, all the compounds show high GI absorption, but only coridine passes through the blood-brain barrier. The results of the molecular docking studies shows that the selected compounds have high affinity for the novel coronavirus main protease, comparable to the FDA-approved drug remdesivir. The findings of this study reveal that curcumin, epigenin, genistein, coridine, and rein have the potential to serve as lead compounds in the development of COVID-19 drugs. Thank you for listening.
Green synthesis of silver, zinc, and copper nanoparticles from aqueous extract of spondias membrane leaves and antibacterial activity. Abstract number 074. Nanotechnology is unfolding as a highly advanced technology, multidisciplinary with chemistry, physics, material science, biology, and medicine. The application of nanoparticles are as follows: sample preparation, drug delivery, tissue regeneration. The synthesis have been by chemical and physical method. However, the green synthesis offers significance over chemical synthesis. The biomolecule implant acts as biotemplates, which are for surface stabilizing agents, faster synthetic rates, economic and environment friendly. The formation of nanoparticle is marked with color change with appearance of adsorbance peak at different wavelengths in the UV visible spectrum. The optical property of nanoparticle depend mainly on its surface plasma resonance. In metal nanoparticles, electron oscillates collectively, and this affects how light interacts with the particles, and specific oscillation depend on the particle size and shape. In these studies, Spondia moonbeam is a fruit-bearing tree found in tropical rainforests worldwide. Hence, the main objective of this study was to investigate the green synthesis of silver, zinc, and copper nanoparticles using Spondia moonbeam aqueous leaf extracts, and determine the antibacterial activities and also characterize the nanoparticles. Extraction was by weighing 20 grams of dry leaves, extracted with 100 ml deionized water by boiling for 1 hour, filtered and stored at 60 degrees Celsius. The preparation of the nanoparticle was previously reported in literature. Characterization was by UV, FTIR, XRD, and SCM. Antibacterial activity was by standard procedures reported in literature. MICs were determined accordingly using ciprofloxacin as reference standards. This table shows the FTIR analysis. It shows the functional group in the SMAE and the nanoparticles, the disappearance of some of the vibrational stretch in the nanoparticles, showing reduction effects. The highest zone of inhibition, 26 mm, was exhibited by Spondius moonbeams aqueous extract on E. coli, while the copper nanoparticle demonstrated highest zone of inhibition of 40 mm and 36 mm on Pseudomonas and Staphylococcus respectively. The table here shows the MICs. The MIC of ciprofloxacin was 0.002, 0.008, and 1.024 microgram per ml for E. coli, Staphylococcus, and Pseudomonas respectively. The MICs of the nanoparticles were much lower than that of the aqueous extracts. The FTIR showed shift in prominent bands, indicating some reduction effect. The nanoparticles varied in color. They were rod-shaped, size ranging from 65 to 90 nanometer, as observed with SCM and SRD. Antibacterial potency, copper greater than zinc and zinc greater than silver nanoparticle. Activity were more on Staphylococcus than Pseudomonas, and this is also greater than E. coli. It has been reported in literature that the interaction between the ultra-size and large surface area of the metal nanoparticle with proteins containing sulfur in the bacterial cell wall causes DNA damage, inhibition of cell proliferation, and death of the cell. This synthesis offers a simple, eco-friendly, and low-cost technique for development of novel antibacterial agents. Our future study will focus on evaluation of wide range of biological activities, including antibacterial, anti-cancer, antiviral studies, as well as full characterization of the nanoparticles. Here are the references. Thank you for listening. Green synthesis.
Okay, so that brings us to the end of the oral presentation for today. Can we have Adeyemi DK and Ahmed AH or Akali YI, whoever is ready to take the questions? If you can just turn your video on so that we can spotlight you and be able to take questions. We already have one question in the chat box for Ahmed and Akali YI, the first presentation, the first oral presentation. We have a question in the chat box for them. So, Ahmed AH or Akali YI, any of them. Okay, we have Mutiat Ibrahim has her hand raised. She has a question. I would call you up very soon, Mutiat. Okay, do we have Ahmed on board or Akali YI? Okay. Mutiat, please, you can go ahead with your question.
Okay, thank you very much. That was a beautiful presentation. I just want to ask, for the docking of the selected ligand against the protein target, was it a blind docking that was done or was just the general docking? Was the docking done on the active site of the targeted protein? That's my question.
Thank you very much for your question, Dr. Mutiat Ibrahim. Unfortunately, we don't have any of the authors on the available on the call now to take your question. Ahmed, he has not joined audio. Okay, so Ahmed AI but has not joined audio. Unfortunately, the authors are not available to take your question. Second question by Professor Dejare is also on docking, asking if there are any follow-up with actually testing, at least in vitro. I'm afraid there's nothing we can do about this now. It's beyond our control, but we would get across to them via email with these questions and send their responses to you, okay? So do we have any other question based on the oral presentations? The second presentation, especially because we have the author available to take questions and respond. I'm not seeing any other hand raised. No question in the chat box. All right. That brings us to the end of the oral presentation segment, and we'll move quickly into the poster presentation segment. For the poster presentation segment, very quickly, you would see like an icon, like 4 squares on the left-hand side of your screen, which would ask you to join a breakout session or a breakout room. So if you know the breakout room you want to join, either any of the four, either the clinical pharmacy or pharmacognosy, pharmaceutics or pharmchem, you just click on the join button and join that room, and it will take you to the breakout room where the poster presentations would take place. It's going to be a parallel session, so the 4 sessions would take place at the same time in different rooms. So please, if you are seeing the icon which I just described, kindly click on it. You will see, once you click on it, it will give you the 4 options for the different breakout rooms. You click on the one you want to join and you hit the join button and you join the room. So please, can we quickly do that? And if you're having any challenge doing that, we would add you up manually. That is why we asked that you should add a suffix for the breakout room you want to join after your name. Yeah, Dr. Odimegu's hands are raised. Okay. Wow. It's been a very beautiful day. It's been a very, very fruitful conference. I believe that we all had a very fruitful time. Okay. All right. Sorry, we just needed to chill a bit. So for those that were still in the breakout to join us. Okay, so I believe we all had a very good time at the different rooms for the poster presentations. We are gradually coming to the end of day 1 of this conference. Tomorrow is another day, the day 2 and the last day. I want to ask us all to please join us tomorrow. Tomorrow we'll be having 3 plenary sessions. We have 3 plenary speakers tomorrow. We will also look at our theme from different dimensions. It promises to be a very interesting one as well. So please do not miss it at all. Thank you so very much. I hand over now to the chairman of the planning committee for her closing remarks. Thank you.
Oh, it has been a great day of learning, challenges, putting everyone on his or her toes for researches that can benefit humanity. I want to appreciate the presence of our chief host, the Vice Chancellor of the University of Lagos, Professor Oluwatoyin Ogundipe, ably represented by the DVC ACAD, Professor Oluwole Familoni, who also joined us in Pharm Chemistry room. Our chief host, our dean, our amiable dean, Professor Gloria Ajayi, all our speakers, oral and poster presenters, parallel session chair, all our assessors, planning committee. You are so great. It's good to work with you. I mean, it's very good, sweet to work with you. I also appreciate everyone present, ladies and gentlemen, including all our students. Thank you for your time. Tomorrow promises to be greater. The room will be opened by 10:50 a.m. with oral and poster presentations before the plenary sessions with 3 speakers, as we have been told by our MC. So thank you very much. God bless you. Have a great day. See you tomorrow. Thank you.
Thank you so much, ma'am. Thank you all for staying with us up till now. See you all tomorrow. Bye-bye.